Senator from Ohio is recognized.
Mr. President, I have 6 requests for committees to meet during today's session of the Senate. They have the approval of the majority and minority leaders.
Duly noted.
Mr. President, it has been on, as I've said on this floor many times, the government shutdown had many victims: air traffic controllers, TSA agents, and many other public servants. And of course, the American people themselves, who were the most affected by this. Thankfully, the bill passed in this chamber last week put that chaos behind us. But that wasn't all that it did. In some small way, at a difficult time, it proved that we can work together to do tangible things to reduce health care costs in this country. As a matter of fact, I worked on a bipartisan basis to introduce the Smart OTC Act, which became law as part of the government reopening. It's a good part of that reopening. The bill aims to make lowering the cost of over-the-counter drugs more accessible to patients by eliminating the red tape at the FDA. We know that when you can take a prescription drug and make it an over-the-counter drug, prices go down. In fact, on average, in cases where we've been able to do this, it reduces prices from 30 to 95%. So it was an important part of that provision and an example of a way on a bipartisan basis we can get some of these kinds of things done. It's an example of how we can attack affordability with common sense reforms without adding the debt burden to future generations. And I'm proud to have worked on that bill to make things better for Ohioans and the entire country. But the shutdown is finally over, and I want to thank my Republican colleagues and 8 Democrats who joined us in help ending it. Unfortunately, 40 others chose a different path, and we wasted 43 days from focusing on issues like growing the economy and making things more affordable. I have been in the Senate less than a year, and I wasn't here when Congress passed Obamacare or the Biden COVID subsidies that have been used to prop up the ACA exchanges. But I want to be part of the solution. Didn't create the problem, but I'm here to be part of the solution. We owe it to the American people to honestly assess the problem before we cast a vote on it. Health care costs are rising. The ACA exchange system is too expensive and too complicated, and it has failed to reduce the underlying cost of health care. It's failed. And the truth is, health care inflation is the #1 driver of inflation in the 21st century. And just look at this chart. It shows, beginning of the century, all inflation, healthcare inflation, was about the same. But if you look here around the time that Obamacare was enacted and went into law, you see the disparity growing. Medical care, medical costs, healthcare costs began to spike and rise. It was not a solution for healthcare costs in making healthcare more affordable. As a matter of fact, the ACA made care less affordable, and this problem will not be solved by pouring more taxpayer dollars into the coffers of big insurance companies, which has been the path of how Obamacare has been operated since its enactment. As former Education Secretary Bill Bennett once said of higher education financing, he said, "Higher education is not underfunded, it is under-accountable and underproductive," and that's the same that we can now say of the Unaffordable Care Act. But I believe there is a way forward on the issue that can protect families from punishing premium costs and cut the costs driving inflation. And we can do so without putting another $350 billion on the national credit card for a program we know is dysfunctional. If we want to lower costs, want to lower the cost of care, we must deliver reforms that put patients in charge, and I believe we can earn bipartisan support with a straightforward and responsible framework focused on what I call the fraud, freeze, and fix approach. Fraud, freeze, and fix approach. You do this paired with a short extension of the premium subsidies, and we can address the shortcomings of the ACA, lower health care costs, and provide the American people with something we can actually implement. Now, I want to explain what I mean by fraud, freeze, and fix. First of all, let's deal with fraud. The COVID-era zero premium subsidies that were created a cottage industry for abuse. Much of the explosion of fraudulent enrollees is attributable to $0 premiums, which were created in 2021. These plans are fully subsidized by the taxpayers and have created an incentive to enroll individuals without their knowledge. This is how it works. Brokers enrolling people who never ask for the coverage. 1. 2, insurance companies get paid. 3, brokers get a commission. And 4, taxpayers get the bill. There have been criminal convictions in many states across this country where this fraud is actually being perpetrated. And it needs to be fixed. Hardworking taxpayers have footed the bill for almost $35 billion to insurers who enrolled people who did not use the plan a single time. And we know why. Because not all, but some of those people were enrolled fraudulently. Requiring everyone receiving a premium tax credit to pay a small amount, at least a small amount, towards their health care insurance will help realign the incentives and reduce fraud. It won't be allowable if we construct a program like that. It will make certain that Americans cannot be enrolled in plans without their knowledge or consent. It's an important step if we want to move forward in helping to advance a solution. The second part, the freeze part. We need to limit the subsidies to where they are right now so that it doesn't become a growing burden for the American taxpayer. The ACA required insurers to lower deductibles, co-pays, and out-of-pocket costs for enrollees making between 100% and 250% of the poverty line. However, in 2017, a federal court ruled that the cost-sharing reduction payments violated the appropriations clause. But insurers are still required to lower the costs, but this results in artificially high premiums. Additionally, because the premium tax credits are calculated against the second lowest cost silver plan, silver loading also supercharged the federal subsidy spending in this. It created a system that got gamed, but we can fix it. If we appropriate the cost-sharing reductions, we can lower premiums by 10 to 20% while also delivering savings to the taxpayer. Freeze it and fix it. That's the freeze part. One of the ways that we can not put America in a bigger burden from bearing the cost, the taxpayers bearing the cost, and we can also lower premiums by saving money. And then finally, the fixed portion. This is the most important part. Because subsidies do not lower costs, they transfer the burden. The fix involves how we actually do reforms that lower the costs. There are several bipartisan healthcare initiatives that address lowering the price of healthcare for our constituents. Many may be an overstatement. There are several bills right now that I know have bipartisan support that will lower costs that we can accomplish. For example, price transparency is one of the most bipartisan ideas in this chamber. It gives patients, employers, and small businesses the power to see what the prices are and then compare them and decide whether or not they can find a better deal for what they're paying. Transparency exposes inflated costs, sparks competition, and makes the other reforms that we're talking about actually work because we can price shop and we can find out whether or not we're being ripped off by what we're paying. Another example that I know there's bipartisan support of, PBM reform. There's been a bipartisan appetite to lower the cost of prescription drugs by addressing the role that middlemen play in increasing these costs. Bipartisan PBM reform, something we know can reduce costs. 340B reform. Both Republicans and Democrats have raised concerns about the 340B program. That's no longer efficient or serving its intended goal of supporting patients and healthcare providers who serve vulnerable populations like our rural communities. These are just some of the reforms that have bipartisan support. The list goes on. You can easily find them. We need to do them. It will help drive down the actual cost of health care in this country. Transparency, where I started with this, is a necessary step in the idea of an HSA expansion that President Trump has proposed, where we send money to the consumers rather than to the insurance companies. You have to have transparency if you expect people to shop. This will achieve the intended goal of creating consumer choice, and it would protect families from premium shock and would protect the federal budget. Two things that we need to do: protect families from the cost, the inflationary costs that the ACA has created, but also protect the taxpayer. We didn't get into this mess overnight, and we won't get out of it simply by writing bigger checks. If this debate ends with one side saying, extend everything, and the other side saying, we oppose everything, nothing will get done, and we will have failed the American people. But we have a chance. What I outlined right there, I know there's bipartisan support for. And there's more. But that's a start. Fraud, freeze, and fix. We have a chance right now to do better. Help families afford coverage, pass bipartisan reforms that cut costs, and refuse to add another $350 billion to the national debt. I am the newest member of the U.S. Senate. I wasn't here when Congress created this problem. But these ideas are part of the solution. If anyone in this chamber is willing to work together, let's go. It's time to do it. The time is now. The American people deserve nothing less, and let's get ready to get the job done. Time was wasted during the government shutdown. There is an urgent need to address these issues. Let's go. Mr. President, I yield the floor.